So if you wouldn't mind, I'd love to unpack that a little bit more as well, because there were actually some fairly neat steps that happened, some
Yeah.
more interventions, and which led to an ultimate positive outcome.
Yeah, absolutely. So this patient in particular arrived to the facility, I think in the early afternoon or so, and they ended up going directly, I believe, to the ICU from the ER. And they maintained on the ICU for just a little bit, but then started getting a little bit hemodynamically unstable and starting to have that chest pain, I believe, again. I actually don't know if he was intubated at the time. I think he might have been, so I don't think that he had chest pain, but he began to show signs of that ACS again. And so they went ahead and took him to the cath lab, and they found, let me just double check here. They found pretty significant occlusions in the left main, left anterior descending, and left circumflex arteries. So he had almost a complete blockage of the left side of the cardiovascular coronary system. And so we kind of understand from that now
And
why.
just to
Go ahead.
remind the viewers, what areas of the heart that's going to affect, and what kind of effects those that ischemia is going to have, and those blockages.
Yeah, so the left circumflex and the left anterior descending feed that posterior and lateral, or I'm sorry, anterior and lateral side of the heart. So that's going to be your like left atrium, left ventricle, and then sometimes, depending on how the coronary arteries are laid out, a little bit of the posterior side as well could be affected, and that, so the right ventricle could be a little bit affected in that as well. I believe for this patient, their RV function maintained throughout the entire course, so I don't think we had any issues with the right ventricle at all. But the
That's
left
always
ventricle,
nice, because I don't think
yeah,
the right ventricle sometimes gets the respect that it deserves.
oh yeah,
Because that RV can be pretty fragile, right? And
oh yeah.
not only that, but is still very important if this patient's going to have any kind of outcome that's
Yep.
positive.